Hey everybody, this is Leila, Health Education Manager here at AiArthritis and person living with lupus and Sjogren's. I am here to report on two different lupus sessions that I watched today, one of them being Lupus, What's on the Horizon, and the second being about clinical abstracts having to do with lupus. And the majority of what I'm going to be talking about is from the Lupus on the Horizon, What's on the Horizon session, and a few key takeaway points from the abstract session, because that abstract session also had a few abstracts that had to do with cutaneous lupus, which is not under our disease category. So it's not something that I covered, but we did hear a little bit about neuro-psych lupus and also about the CAR T therapy. So I will touch on that a little bit. This session, Lupus, What's on the Horizon, the speaker's name was Laurent Arnaud, and he is from France. He is a rheumatologist and a professor. And he is on Twitter as @LupusReference, so a really cool Twitter handle to have. And he started out the session with talking about the history of lupus. 1855 was the first time the word lupus was written out and describing a person or symptoms that they were going through. And it was in Latin. And they talked about how 3.4 million people suffer from lupus in the world, and that the survival rate has dramatically increased from 1955 until now. It's been a very steady uprising of survival rate, and it has plateaued now at about 90%. And basically, there are a few different things that are definitely on the horizon for lupus in the next few years. One of the things that they did mention is that precision medicine and biomarkers is not very much on the horizon with lupus. It will take more like 10 to 15, probably, or even more years to really be able to hone in on the biomarkers for lupus, because the disease is so heterogeneous, or it displays itself so differently for each individual person, that it has been hard to nail down a biomarker. What they did say is that a biomarker for lupus nephritis may be more on the horizon, but something for systemic lupus overall is far-fetched. We're in the very beginning stages of it. And so onto the things that are on the horizon, he talked a lot about the different studies that are going on to help improve delay in diagnosis, really focusing on the patient pathway and how to get people referred faster so that they can get treated faster and therefore have more positive overall outcomes. Just emphasizing that without treatment, disease activity will be very persistent and can cause lots of damage to organs that we want to try to avoid. And this damage can happen even very early in the disease state. And one of the things that they want to take a better look at in the next few years as well is going from a positive ANA blood test all the way to the development of full-blown lupus and exhibiting a full diagnosis of lupus, and what kind of happens on a micro level in between that positive ANA and the full-blown lupus, and how we can maybe somehow stop it in between, reverse it, prevent it from transitioning all the way to a full lupus diagnosis. So that's another thing that's on the horizon. They did mention that the latest EULAR recommendations are to start small and then increase treatment or doses if needed. Previously with lupus, because of how damaging it can be, they would throw the whole kitchen sink in it or at it in order to try to control everything. But what they have found, that especially with those high doses of prednisone or other steroids, 60, 80 milligrams of pills, is causing more damage than helping. And so with lupus, there's this dance. Of course, we need the steroids to lower disease activity, but we don't want to have so much steroids that it's causing actual organ damage. So there's that little dance that happens a lot with rheumatologists and trying to figure out what the right dosage is for patients. And so the new EULAR recommendations from 2023 do exhibit starting lower and increasing when necessary. And there is something called a high genetic risk score that they can calculate for people and their genetics, maybe those of loved ones whose parent may have lupus and things like that. And so this high genetic risk score it correlates to higher risk of developing lupus, earlier onset of lupus, and severity increases, and the likelihood of developing lupus nephritis also increases. If these tests can become readily available, we can try to see what we can do, again, to either prevent the onset of lupus or to help to make it as minimal as the damage as minimal as possible. And they talked a lot about digital health and AI, and how AI should not ever really take over what a rheumatologist is doing, but more so be able to just assist with some of the evaluations. Maybe it can help identify a lupus rash, or it can help with analyzing the test results, things like that. And treat to target is a huge thing that they were also talking about. Obviously the target is remission, but for many patients that might not be a full reality. It might be very hard to get to remission. So another target to aim for is LDAS, or also stands for Lupus Low Disease Activity State. And it basically is a little bit lower standards than remission, but a transition state to aim for if remission is very far out for a patient. And so this LDAS score is something that a lot of rheumatologists are starting to work towards, just to get patients in a stable state. And let's see. Lastly, I wanted to talk a little bit about the things that were happening during the abstracts. And they did talk about something called Lupus GPT, which is, it's not fully functional yet, but it will become basically an AI system that has access to a bunch of different lupus resources, that whatever questions a lupus patient may have, it can give a very sensible answer. Obviously, again, would it replace actually seeing your doctor, getting your labs done, things like that. Last thing that can be helpful in the digital space would be for biodata collectors, or things like Apple Watches, Fitbits, to be able to collect some data that would be helpful for rheumatologists and to be able to see a better understanding of what's going on in someone's body. And last but not least, we have the CAR T cell therapy that we have been talking about. And there was a really awesome study that was saying that CAR T cell therapy is durable, long-lasting, and has been able to achieve complete remission with no medications for up to 2 years so far, and resets all B cell memory in order to remove autoimmunity or having those cells attack each other. And lastly, Rituximab went through a study with neuro-psych, basically saying that it is very effective for those who may have moderate to severe neuro-psych, and help to decrease steroid use over 12 months and really help with quality of life. So I really want to be able to share that with you. So I'm going to see if we can get it into the email, because he really makes amazing PowerPoints, and I'd love to see one of his presentations in person one day. But yeah, that was about lupus, and I hope you enjoyed.